So good afternoon, everyone. Bienvenidos. My name is Dr. Jaime Gonzalez. I'm a board member of the Cuidado Casero Foundation. It's a pleasure to be here to serve as one of your co-moderators for this panel that we have this afternoon. We want to make it very interactive. Just a little bit about myself. I grew up here in the north side of Fort Worth, went to Northside High School. I know there's a lot of steers on this call, so I was one of them too, but back in a long time ago, back in 83, class of 83. I went to schools here in North Texas, Texas Women's, UTA, UNT Health Science Center, the School of Public Health. That's where I got my doctorate. And of course, I started at TCC, right? We got to all start at TCC at some point. So it's a pleasure to be with you today. I am a doctor of public health. This is a very interactive panel, so we want to hear your questions, what's going on in your life, what you're planning to do, and you're going to hear from some great panelists. Now, I'm going to let my co-moderator, my very good friend Teresa Ayala Bruton. Terry, you want to go ahead and introduce yourself? You want to go ahead and introduce yourself, Terry?
It looks like you're muted, Terry.
Yeah, you're on mute.
Hi, good afternoon. I'm Teresa Ayala. My name, and Jaime calls me Terry. So that way there won't be any serving also on the advisory board for Cuidado Casero Foundation. But I'm also on the board of trustees for Tarrant County College, and who is hosting this event. So we're very happy to be partnering with Cuidado Casero. I'm also a product of Fort Worth. I attended Diamond Hill Jarvis High School and actually attended TCJC with Dr. Gonzalez. Yeah. We took several classes together. And so we've been friends for many, many, many years, and we've remained in touch and contact with one another throughout the years. I attended Texas Christian University, both for my bachelor's and my master's degree. I've worked in IT for a tremendous amount of time, but due to circumstances that were beyond my control, I actually wound up working in healthcare about 3 years ago, and it is exactly where I needed to be at working compliance for Texas Health Resources, and absolutely love it. So we are so happy to have you and happy to have this interactive conversation with you. And we have an amazing, amazing person on the panel to talk to you, to share her insight. So we look forward to chatting with you.
So with that, welcome again to everyone. Carly Wyman, she is a nurse. She's the Director of Services at Cuidado Casero Home Health and Hospice. Carly, do you want to go ahead and introduce yourself and tell us a little bit about yourself when you get, just like what Terry and I just did, before we get started?
Yes, my name is Carely Weyman de Leon. I am an internationally educated registered nurse. I moved to the US 2015 and started working with Cuidado Casero Austin. 2017, I moved to Medical Health Management in Southlake, Texas, and I am currently, since 2019, in El Paso, Texas, as the Director of Services and alternate administrator for one of the Cuidado Casero Home Health and Hospices.
Carely, thank you and welcome. I'm going to say the name right now, Carely. Love it. Latinize that name, Jaime. So, Doctora, now it's your turn. It's a pleasure and an honor to introduce a very longtime friend. I think, Doctor, I was looking back, it's over 20 years that we've been friends. And founder and president and CEO of the National Hispanic Medical Association. Olvídate, this lady, like, she knows Latino health inside and out. She is like the madrina, the godmother, whatever you want to call her, of Latino health. I'm going to, Doctora, without further ado, I'm going to let you introduce yourself because you've got an impressive background, and I know I won't do it justice. So I'm going to let you tell the students about yourself and what you do and who you are and all that.
Okay,
go right
well,
ahead, Doctora.
I thank you, Jaime, and yeah, we've been friends for a long time because we've met in different meetings here in Washington, D.C., where I live, and also in California, where Jaime used to work. And so let me just say, I grew up in Southeast Los Angeles. Pico Rivera is the name of the city, my hometown. My grandparents came from Mexico, and my parents were born and raised in Los Angeles, you know, in the 1930s and 40s when you didn't talk Spanish. So we were raised in the 1950s, my sisters and my brother and I. I'm the oldest of 5. And, you know, my parents just wanted us to succeed and do what we could to you know, accomplish our dreams. I'll just say that. I don't think we were pushed to do anything specifically. But when I was in grammar school, we ended up going as a family, three sisters, into a Catholic school. So I didn't start Catholic school till maybe fourth grade, but I became the head of the class. It's just a miracle, I thought, but I was just really good in math and science and really liked to study. And I owe it to my mother who taught us how to read and go to the library when we were little kids. She taught us how to play the piano, I think, when I was 5. And anyway, so I was an overachiever, and I earned I got an award from the Catholic schools that gave me a 4-year scholarship to an all-girls high school. My parents would never have been able to afford that. And from high school, I learned how important it was to have good friends and get involved in clubs and that type of thing. But my mother was very interested in having us learn about not social, but civic participation. We always had voting at our house. And my mother actually got involved with the Democratic Party and did, helped with some little fundraising campaigns for somebody named Hilda Solis, who actually was a community college trustee, a community leader, right? Up and coming, she became an assemblywoman, then a congresswoman. Now she's a supervisor for all of Los Angeles County. And my mother got involved with a few other campaigns too. And so anyway, I guess I got the bug. And when I went to college, and I'll stop here. I went to Stanford University on a big scholarship. I don't think I had to pay anything, maybe just, some of my parents' contribution. And I really enjoyed learning how many students like me were very interested in doing things to learn a profession, whatever your career passion is, in this case, healthcare. I was interested in healthcare because my mother became a nurse. And, my dad worked in a factory and was always telling us how to work hard and pay attention to what you do, do good things, be positive. But my mom was the one who was the career influencer in my life. So when I was in high school, I ended up working at a hospital where my mother worked on Friday nights. So when I went to Stanford and the students said, "What do you want to be, a lawyer or a doctor?" I thought, well, I guess a doctor because I know healthcare. But I really did enjoy science and math and all the pre-med classes. And so I'll stop there. I have a lot more to talk about, but I'll answer some questions and talk about how I ended up going to my career of public health and a public health school, and then medicine and medical school, and then getting into the government. Jaime?
That's a great introduction, Doctora. And our third panelist, just to write you, so really good. So some students, here's what I'm gonna tell you before I introduce our third panelist. I want you to at least write down one question, and I want you to post it in the chat because we're gonna hit with questions. Terry and I have questions, but we want to hear from you. This is all about you today. And we've got a great panel of experts here that you guys, I know you want to ask questions. I know you want to ask questions. So I'm going to introduce Monica Silva, and then we're going to move into questions. And Monica, thank you for joining us. I know you had to jump on just a few minutes ago. She is a physical therapy assistant and the home care rehab services. So Monica, I'm going to give you the floor. Tell us a little bit about yourself, kind of like what you heard Doctora do, kind of a little intro about yourself, what you're doing, what you've done, how you got where you're at, and then we're going to kick it off with some questions from the students. So Monica, the floor is yours.
All right. Okay. So, well, I'm originally from Brazil, and I have been living in the United States on and off for about 17 years. And I have my degree in physical therapy, actually, and that I did it in Brazil. I graduated actually in 2002. And so I came to the United States right after, just to the goal of learning English. And, as a lot of immigrants ended up loving the country and staying. But in this period of time, I had different careers. I ended up working banking. And anyway, I just decided to go back to physical therapy a few years ago. And so I did not have to go back to school. I just had to do some classes to be able to take the boards. But anyway, it was a long path. And since I had graduated for a long time, it took me a while, to study and pass the boards. Anyway, now I'm here and I have been working as a PTA in home health for about 2 years and a half. And I really love what I do. And that's it about me, a little bit. And we can talk more, when all the questions come up.
All right, Monica, thank you so much. Great introduction. Okay, so let's see, do we have a question? So here is the question. We got our first question. It says, and I'm going to throw this to all three of you. And Monica, since you went last, I'm going to have you go first, okay? And here's the question the other two panelists can be thinking about it. It says, what made you want to get into health? Great question.
I always like anything related to health. I'm the kind of person where I can watch all those medical shows on TV where a lot of people can't stand watching blood and everything else. And I always like to work with people one-on-one. So it's something, and I have a couple cousins in my family that they are doctors. So it's something, I don't know, it's something that you really have to enjoy, because I think, I see my husband here when he watched those shows on TV with me, he can't really stand. So it's something that I don't know, I think it's on you kind of when you grew up. It's something that since you're little, you already figured that out. It's not something that happens over time. One day you'll be like, okay, that's what I like. I think it's something that happens over time in your life. And that's what happened to me. And that's why I went to that field.
Thank you, Monica. Carelli, what's your take? Or Doctora, either one of you can go next.
I was just going to say, I think for me, it was when high school, being able to work in a hospital, and it was just one night a week, but I was a messenger and got to take flowers or take mail or, take different instruments that were cleaned in the cleaning room, where they sterilized instruments and packages to the different wards in the hospital. It was a community hospital. But I think it was interesting to be able to meet nurses and doctors and the people that actually work inside a hospital and to understand from their perspective how they all see their careers of really helping people that are sick. And you don't understand the important role of a health career person until you talk to somebody or you go and see them in their setting, whether they work in a doctor's office or a dental office or a clinic, and you get to understand, gee, I could see myself doing this, the day in the life of a person, whatever that person is that you want to be. You have to go and find it and see if you fit into that picture.
Thanks, Doctora. Carelli, what's your take?
So for me, it was, I want to say like a calling, because I decided to go into nursing school in Mexico. And in Mexico, we're not rewarded financially as a nurse. We're not seen as a respected profession in society in Mexico. So honestly, it was just, I wanted to help people. And later I ended up coming to the US where it's completely different. But that's how it started, just wanting to help people.
That's great. There's questions are coming in. Students keep popping in. I've got another great question, and Doctor, I'm going to pitch this to you to start it. It says, did you always have a specific field in mind? So I'm assuming in the specific field and healthcare, because yes, good question, because the professions galore in healthcare and in health. You may not be in direct patient care. There's so many other opportunities. So I want you guys, the panelists, to be thinking about that. What's the variety that's out there? But this is a good question. Tell them a little bit about yourself on that question, but also what else is out there when it comes to health, because there's a big field out there.
Yeah, let me say the medical profession has lots of professional careers. When you're a professional career, it's a lifelong learning career. Doctors, nurses, dentists, physician assistants, nurse practitioners, and others, right? You have to get a license And to keep your license, after you go to school, after you take your board exams, you get a license. To keep your license, you have to go to conferences and meetings and take classes that are continuing education. So that's a difference between the professional and the what we are going to call allied health careers. Allied health careers just means all the different health careers. Like if you're in a dental office, you know, the dental hygienist is more considered an allied career. The dentist has to take those exams and lifelong learning to keep your license. So just, okay, so that's one thing. The second thing is I decided that I wanted to be pre-med and wanted to go to medical school from the day one that I started college, because at Stanford University, and it's a big university, a lot of the pre-health students, that's what they wanted to do. And it depends on where you go to college. A community college, you can get a 2-year degree, and there are options to get into health career jobs. They're more vocational jobs, which means you don't have to have that long career in education that I did. My mother went to a community college. In fact, I know friends that went to community college and then they went to 4-year universities and then they went to medical school. But anyway, when I went to Stanford undergrad, I decided that I really liked organizations and how to get involved in organizations and help, help organize, help develop, help make this plan events, those types of things, right? And I also decided that I really liked the idea of learning how to change things in a health career, in a health system or in a health organization. And so I went to Washington, D.C. as an intern when I was a junior in college. And when I went there, I thought, oh my God, this is what I want to do. I want to come into the policy world to be able to change healthcare for my community, for Latinos or African Americans or others that don't have a lot of access to healthcare. And and there's so many problems. I don't want to talk about the problems, but anybody can get engaged in being at the center of the universe and control and make decisions, whether you're in a clinic or you're in a hospital or you're in the state health department. I just happened to really understand that I wanted to be in a national government, federal government, helping to make changes that would affect Los Angeles, California, Texas, Florida, different places where Latinos live. So that's why I did what I did. I think I decided that I would go into internal medicine, which is adult medicine, because as I got to know the different types of doctors, there's baby doctors, there's women doctors, there's infectious disease doctors right now for the vaccines, right? It seemed that the adult doctors would have a better understanding of how to make changes for healthcare, which is mostly used by adults who happen to be the ones that get sick. And so we get more sickness as we get older. We get high blood pressure, we get diabetes, and the older people are taken care of by internal medicine doctors. And I wanted to understand how to make policy changes for the adults in our communities, our grandparents, our parents, and how they use the system, how it can be more affordable for our communities, how we can have better health insurance, Medicaid, et cetera. So anyway, so I'm hoping to connect the dots there, Jaime. And that's how I ended up going into policy and public health school first, and then medical school, and then jumping into the internal medicine. And then I did a policy fellowship and ended up working in the government. I went to a government job in California, in Sacramento, and then Washington, D.C.
Thank you, Doctora. Mike Carelli, who'd like to jump in on that? Who'd like to, Carelli or Monica? You want to add your perspective as well? Can you guys hear me?
Yes. Well, so the question is like, what made you get into health field, right? It's just I always had like in mind, I wanted to be, like I said, in that field. I wasn't sure about what profession to pick. And back in 1998, in Brazil it's a little different because when you're done with high school, you gotta choose, what you want to do, and you go straight. You can really change your mind, because if you do change your mind in your first year or so, you pretty much lose everything and you have to start all over again. And physical therapy was a new career back then. So I did some research and I found out that I could have more doors open because I could work in a hospital, I could work in outpatient clinic, nursing home, home health. So it was different. I was like, well, if I don't like much the hospital, what else can I do? And I thought it was also fun because, especially people that are active and like working out. So it's two things combined. So that's how I pretty much went that way. And one thing, an advice I give to all the students is just, do your research, and because you have to study a lot, and sometimes we don't really understand, we don't have much an idea, and especially taking the boards after. So it's a long journey, if you decide to go for a PT or the PTA. But anyway, it's something that you gotta really have figure it out before you go that way, because you don't want to lose time. You just want to start it and you go and finish everything.
Thanks, Monica. So, Kareli, I'd like you to also give your perspective, but also included in your perspective, some questions have come in and some questions that I've been thinking about. When you're telling, why you chose and how you chose, talk a little bit also about the challenges that you've experienced when you were going through that process. And another question came in if there was anything, that you would redo or change, or some consejos, if you will, that you would give to the students because of challenges you met. And the other two panelists, Monica and Dr. Ariel, be thinking about that, because I'm going to start, with Kareli saying a little bit, but then also dive into that next.
Yeah, well, I have like a similar story like Monica because, when I went to university, it was in Mexico. So it's not like you go and get your, all the classes that could potentially lead to different degrees. You actually have to choose your career. So you're very young, you're leaving high school, and they're like, what do you want to be for the rest of your life? And I encountered a lot of social pressure being in Mexico, and people wanted to say like, well, be a dentist. That's better. You'll get more money. That's more recognized. Be a dietitian, be a doctor. So it was hard socially. My family, thankfully, was very, they were like, it's up to you. It's, the rest of your life. And university is 4 years in Mexico and 1 year of servicio social, social service, where you pay back, I guess, for the 4 years of schooling, because it's pretty cheap in Mexico, but you have to work for a year for the government to pay back your schooling. So definitely choosing nursing, I just couldn't see myself looking at teeth for the rest of my life, or like I put into perspective, like, could I do this for the rest of my life? And nursing was what I wanted to do, and I'm very grateful because I ended up doing nursing in the US, and that has opened a lot more doors, a lot more opportunities. So I guess something that I could say, not like redo, but trust your gut. Go honestly think about, of course, it's something that you're gonna do for a long time, maybe not the rest of your life. It is, you are putting in a lot of years of studying. So definitely, of course, take into consideration what your friends, peers, parents have to say about the career path, but ultimately, trust your gut. It's usually right.
Thank you. All right. So, Doctor, I'll come back to you and then Monica next. So, again, now we're
Okay.
talking about challenges and redos and that kind of thing. Think of the
Well,
students that, they're going to be in that process. So what did you learn, and what consejos can you give them? What advice can you give them?
well, I learned early on that I really enjoyed what I was doing as I went through it. You have to understand what are the different options that you have, like for that year in school, that like your freshman year in high school, sophomore year, junior year, and try and do different things, build up your portfolio of skills. You don't want to do the same thing for 4 years in high school or 4 years in college. And I think the challenge is there's so many things that you don't know what you can't do everything. You have to say no. I still have that problem. I can't say no. But you have to be able to start shaping your future. And you don't realize it, but you shape your future by the opportunities that you actually do take on. And you take on something usually because you're passionate about it and you like it, or you can do it, it's affordable, and or maybe some of your friends are involved. And I think that's the other challenge, is you don't want to do something by yourself. You want to be able to have a support system. So when I was in college, studying with others, I went to the library and learned to, study with others, and there's study groups and there's projects that you do together. You have to learn, what your likes and dislikes are. So the challenge is really getting to know yourself and understanding the opportunities that you have in front of you or around you. They may not just be in school, they may be because of your family or your family's connections or linkages. It might be from a club like this, an organization like this. And it's very important to take advantage of opportunities that will help you make decisions to keep moving forward. And I would just say, if there's negatives around you, drop them. Move away from people who are, especially people who are stuck in their own rut. People have a lot of problems. Everybody has problems, but you don't have to make them your problem. And it's hard because some of those people might be your family members, but you have to understand how to be careful to not to get in arguments and get upset, because you need your time to study and you have to learn how to be selfish too. So I'll stop there.
Thank you, Doctora. Monica, your take and your perspective on the same questions that are coming in from the students.
Yes, and also I'm gonna go ahead and, if you don't mind, answer the question that somebody
There
asked.
was a specific question for you as well. I was hoping you would see that. So go right ahead and dive into it all. Thank you.
So, well, the way I knew that was the right choice, to go back to physical therapy, it was because, deep down I wasn't happy. I had a good career. I was in banking for a while, but I was like, that's not what I studied for. And I spent so many years of my life, and that's what was my passion. And I was always thinking to myself, I'm taking too long to go back. And like somebody else was saying here, yes, do not take too long. And if you have opportunity to go back to study, just go for it, because the longer it takes, harder will be. So, but it was pretty intimidating. I have to set back, I had to quit my job, and I went to work for HI physical therapy. I don't know if you guys are familiar with, but it's outpatient clinic, where working there as a front desk and also being able to assist the PTs and learning from them, because it was a long time for me since I graduated. So it all came together. I had to study a lot. I had to work full time and study full time. So it was really hard. But at the end of the day, it all pay off, because I'm much happier now, and financially it's way better too. So that's how I figured it out, that was the right time to go back.
Thanks, Monica. Doctora, a question just got posted in the chat a few minutes ago for you, and it says, as someone in current nursing program and also interested in politics, how can I start working towards a career in politics / government like yourself? once I graduate from nursing school? What consejos, what advice, doctora, do you have for her?
Well, I think at the local
For him,
level.
I'm sorry. It was a question from him. Sorry, excuse me.
Yeah, that's okay. At a local level, well, first of all, let me just say, I didn't get involved in politics per se. I got involved in policy making and providing research for policy makers. Okay, so there's a difference. But at the local level, I would say there are opportunities to get engaged with your local state assemblyman or woman and senator, the state. And what happens with the states is they're always looking for people in the communities that they represent. They have town halls, they have staff, they have an office that wants to get engaged and understand what are some of the problems in the community, and more importantly, what are the solutions. So as a nurse, as a doctor, as a dentist, you're going to be working in their district, and you're going to be in a hospital, or you're going to be in a clinic, and you could tell them, I think there's some things that could be improved upon. Now, you may not know all the policies that they know, but they need to understand how the policies, are they working or not working for your community? And so you become people don't realize how important you are to the policymakers, especially as from our poor communities, when government is really there to make to get taxpayers' money in the United States, to help that money be divided up among all of our departments. The government has different departments. There's a Department of Transportation to have better buses and public transportation, right? Well, in healthcare, the money goes to create a health system that can help the poor and help the needy, and also help insurance companies and pharma companies do things for the good of the public's health. And that means not to make a lot of money, but to really help the people that need the help. And so who better to tell them what to do than the people that come from our communities? Because the Latinos in this country, 1 out of 4 Americans are going to be Hispanic. And this country's policies have got to start changing to include us as the template for the rest of the country. Just like salsa is now being used more than ketchup, or Latin music and Tex-Mex music is more common than it was in the past. We are taking over this country, but the country's not changing its policies because we're not part of the government. So I just think it's an amazing opportunity for healthcare to be changed with Latinos in the healthcare system.
Thank you, doctor. And something I wanted to add, that's a great question, David, that you asked. I was thinking about that, doctora, because I think of my own career, and Terry, I want you to jump in too, because you are an elected official here in our county. But the way you can get involved, whoever your representative is, go to him or her. They have all kinds of advisory councils and so forth. I served for my congresswoman is Kay Granger here in Fort Worth, where I lived. And I served on her Hispanic Advisory Council for 4 years. The pastor at the church, a very good friend, Father Esteban Hassel, he had told me, he goes, Jaime, you should get involved in that. You're in healthcare, go get on that board and I will help you. And he did, and I was on there for 4 years. I was putting in our voice I'm a doctor of public health today, but I was a clinical case manager and healthcare professional, worked in insurance and worked in hospitals, all of that. And I was able to give my perspective as a Latino citizen and a constituent of hers, but then also with my healthcare training and background, I was able to infuse, hey, this is what's going on in our community. I was with my boss, I was the National Director of Latino Health for United Healthcare, which we had a lot of influence and worked with a lot of and elected officials. That's how you do it at the local level. Call your member of Congress, say, I want to get involved. Call your senator. And if you're in Texas, unfortunately, one of them is Cruz, excuse me, I'll put that to the side, and Corded. But you got to call them and ask, you want to get involved. And then Terry, I'll let you close, and then I'll be quiet because I'm a talker over here. Carelli, you go first.
I guess what I would like to say is it's okay if you're afraid, you know, just do it regardless. We're all humans. We're all, afraid of change, afraid of new things, but it's okay to be that, but just go ahead and go through it. Yeah.
Monica, what's your aviso, your pearl of wisdom you like to leave with the students?
Well, I would say don't give up, just if you're passionate about what you do, you all come together. So just keep going. And even if you get denied more than once, uh, just do what your heart is telling you, and you'll be able to do it. It's going to be hard. It's not going to be easy. Nothing is easy, but you're going to be able to achieve.
And Doctora Elena, you get the last word on this one, then we're going to go to you, Terry, to wrap.
At the National Hispanic Medical Association website, we have a college health scholars program, and we have a page with information for 3 buckets: how to be better at academics, how to study, right? How to be better at your own personal development. That might be relationships, that might be time management. And the third one is lots of information, especially about scholarships, on how to finance your education. So I would say my last comment here is we have to learn from each other, and that's what we've done for the last 3 years now. We're in a 5-year program. We are learning from students just like you who want to go into being a doctor or a nurse, dentist, public health. And we put all these good ideas and resources on our website. And the website is nhmamd.org, and look for the College Health Scholars Program.
Thank you, Doctora. Terry, you want to make any closing remarks as well? I'm not sure if she's still connected or not. I think she probably froze. Well, I just to say this, I agree with all those consejos of the panelists here. The one thing I would say is that network. All of these people on these panels today, all of these people you've been hearing from, make sure this is something I learned a long time ago from one of my mentors, Dr. Ayala Gonzalez, and that's about networking. So make sure that you surround yourself with successful people, and that is through networking. So right here today, students, you learn a lot about all kinds of things. All these people you talk to, make sure you reach out to them. You got Doctora Elena Rios, email these people and say, I'm interested. Will you help me help folks? Will you give me a tip on, do that? All of us included on these panels, because that network, that's what's going to move you forward. That network is going to, so surround yourself with people who are successful, who are in the careers you want to be in, and network. So with that, thank you, Doctora Rios, National President and CEO of the National Hispanic Medical Association. Monica, thank you so much for serving on the panel. Kareli, thank you so much for all of these perspectives. Are so needed and so very helpful.